From our 22 News Broadcast Center, this is 22 News in Focus.
Good afternoon and welcome to 22 News in Focus. I'm Ciara Speller. People across the country are suffering from COVID-19 burnout. Many have sought out mental health services because of feelings of helplessness, despair, fear, anxiety, and even suicide. Health providers are reporting stress and anxiety levels are reaching a crisis level in children and teens. So joining me today to discuss what can be done to reduce this growing problem is Enrique Vargas Gonzalez, an outpatient psychotherapist at the Gandara Center. Thanks for being here with us, Enrique.
Thank you for having me tonight.
So I want to ask you, are you seeing an increase in demand for children and family services?
Yes, there's been an increase in all the services related to mental health, behavioral health services, and substance use as well.
And what types of services do you offer? Let's have you talk about that for our viewers.
Gandara Center offers children behavioral health services, in-home behavioral and in-home therapy services, as well as substance use recovery services and intensive foster care services.
And which programs and types of resources are in demand right now, would you say?
I would say all of them, particularly children and families are in need in services. There's been an increase in substance use as well, so there's more need of that. And also as people are trying to readjust, for instance, going back to school and other changes in family dynamics and society in general, there's more need of all type of outpatient services.
And so when people are coming to you, what is it that they're saying that they're in need of?
Well, for example, there are, like I said, readjustment processes which are causing symptoms such as anxiety, depression. There's also substance use related issues in children and youth as well. Families are having problems how to handle situations related to the pandemic, and we are working to help and support these families, both in the clinic or our offices as well as at home.
And so how many children and families are involved in your programs?
Gandara Center is helping approximately 15,000 children, youth, adults, and families in general across the state of Massachusetts every year, which is an important community considering that we offer bilingual and bicultural services.
And so 15,000, that's a large number. And of course, you've seen more of an increase with the pandemic, right?
Right, yeah. It's increasing, and also we are trying to promote our services because some people, even though they know they have access to these services, they don't try to find us. So we are trying to reach out to them and support them in every way we can.
And like you said, bilingual services, of course, that's extremely important, and there's the need for that here locally, right? So talk about that a little bit.
Sometimes a little bit hard to access. Sometimes people don't know that there are professionals that can offer their services in their native language. In Spanish, for example, we also have people that speak Portuguese and other languages as well. So we try to cover as much populations as we can.
And how is that being made for them to find that resource?
Well, it's important to remember that minorities have a harder time accessing these services. So it's important for us to try and just give them the resources, and we, the professionals, are always open to, if we are not able to give them what they need, help them find the resources everywhere in the state or within our agency in all of the programs that we have available.
Yeah, very important right there. And have you seen an increase in youth residential treatment?
Yes, as well as substance use. Residential services are in need because there's been a lot of changes happening within family systems and dynamics as well that have left, especially the youth, which is one of the populations that experience homelessness, unfortunately, in our society. So we are receiving a lot of requests for these type of services.
Yeah, and so for a point, it seemed, a lot of people thought things were getting better now. You're so much fatigued because of the pandemic, but now with Omicron, it's going in a trend that we're not really happy about. What do you think moving forward? What do you think you'll be seeing?
I often talk to my clients about this because they ask me, how long is this going to last? How much time do we need to keep doing this? Staying home, wearing the masks, following the recommendations. And I tell them that it's going to take a while. We have to be patient. We have to follow their recommendations. And we are here to help them and support in every way we can.
And I want to ask you about foster care. Are people still willing to take in children at this time?
Yes, foster parents are still willing to take children and youth who need this service. There are several steps that need to be taken because of the pandemic, including people getting tested and other steps, but it's still possible. And also, if the people watching us are interested in becoming a foster parent, they can visit our website, gandaracenter.org, and they can find more information about this program if they want to become a foster parent.
Yeah, and so what would you say to our viewers right now, just about, again, everything that you're seeing going on?
I would say that mental health is really important, and we have to address that aside from the pandemic itself, because the pandemic is affecting everybody. We are all involved: children, parents, caregivers, teachers, everyone in the community. So it's really important that we help each other and support each other. So asking for help and just being aware that we are going through a very difficult time, it's very important. So don't hesitate to look for help. Gandara Center is always there. If you need any services, give us a call or contact us through our website.
Okay, Enrique Vargas Gonzalez with the Gandara Center, thank you. And when we continue our conversation, we'll have a little bit more on this. You're watching 22 News in Focus. Welcome back to 22 News in Focus, and today we're talking about the growing need for mental health services in our region and across the country. Earlier this month, the United States Surgeon General issued an advisory on the urgent need to address the nation's youth mental health crisis. The pandemic added to an already overburdened system that was struggling to meet the mental health needs of children and youth even before. Some are turning to substance abuse and self-destructive behavior. So, Enrique, I want to ask you, what are some signs that should alert parents and caregivers that a child may be struggling?
This is an important question because sometimes with everyday life, people are busy. We don't notice that things are happening, particularly with children. We send them to school. We think everything is okay, but then after a while we notice that something is happening. It's important to notice, particularly in routines and behaviors that we are used to see in our children. I would say sleep, quality of sleep, and appetite. Any changes in their mood and behavior, such as, depending on the age, can go from being more aggressive to isolating more, to be more defiant, or any other changes in their attitude, the way they talk. Maybe they talk more, maybe they talk less. Any changes, and sometimes the parents don't necessarily notice, but other people might make a comment about something different in their children's behavior, or just the way they are expressing their feelings. So it's important to be aware of all these changes. Sometimes the school notices and they tell us. I see a lot of parents sometimes trying not to acknowledge these changes, even though they seem important. But everything right now is important, particularly with children going back to school and trying to readjust to this routine.
Right, and so going off of what you just said, sometimes children will even hide their feelings and they'll tell you that everything's fine. So what are some ways that you could approach your child to find out if they're struggling?
Well, something we have to remember is that especially children, they repeat what they see, right? So if adults can show them that it is okay to express how you feel, whether it's a positive feeling or a negative feeling, they would be able to understand and accept that this is okay, and they would feel more comfortable sharing what they're going through. Also, this pandemic is something very serious, affecting everyone. So we should be talking about it instead of trying to pretend that nothing is happening. So they understand that something serious is happening, and we are doing our best to go through this situation together as family or, within our community.
And when should someone consider contacting a pediatrician or a mental health clinician for their child?
I would advise to contact a pediatrician or a mental health provider whenever they think something is going on. Again, even if it's somebody else's comment, somebody else is noticing a difference in our child's behavior, either from the school, from another parent, from a family member. They usually tell us, but we sometimes try to perhaps justify or find an explanation to what is going on, besides being something that we need to look after, to search for maybe help or some answers. So whenever you feel like something is going on, I should at least get some advice and some recommendations, either from a doctor or from a mental health professional. There are different types of services, so it doesn't have to be necessarily a psychiatrist or a therapist. It can be many other types of services, like a therapeutic mentor and any other services that the community or agencies like Gandara Center provide for youth and children.
And like you mentioned before, sometimes it's the schools that come to you, right? So how can schools play a role in helping a child? I would say the schools can educate the children in regards of what the pandemic means. They can also give them basic skills related to talking about well-being, talking about mental health, as well as perhaps teaching them very simple exercises during class time to learn how to breathe, to relax their muscles, to talk and express their feelings by doing activities within the class, and even homework that might include the family perhaps, that can address what they're going through. It's possible to educate and also make it a therapeutic tool as well. So the schools play a very important role in this situation right now. And I just want to quickly touch on this too. So what are some of the factors that can influence the mental health of young people? There's social media, financial instability, safety at home, maybe even bullying,
There's a lot of changes that came with the pandemic. Some people responded better by staying at home and taking classes there. Some students, for some students, was really hard in terms of not having socialization with peers or friends. This led to isolation, and something very important to mention is the increased time of social media and the use of their phones and tablets, which can be an advantage or a disadvantage depending on how it's used. Some studies conducted in the last couple of years, 2 years actually, have shown that the increased amount of time that, from youth and children of social media and phones is around 5 to 10 hours a day, which is it's a lot considering how much time they have free after school. So we have to consider that everything they have in their homes or available to them can be used as a tool, as a helpful tool, or it can become harmful depending on how they use it.
And lastly, how can we as a society support the mental health of children and youth?
Well, like I said, by showing them that we're all going through this, it's affecting everybody. It's not like one particular group of people is not being affected by this. Everybody's being affected by this. So we have to acknowledge this, give them the opportunity to express themselves, which is something sometimes they don't feel like they have this opportunity to show that they are either angry or sad or worried, and then to share that. So the family has to go through this together and also heal together as a community as well.
All right, Enrique, thank you so much for your insight. And adults are feeling the pressure from the pandemic as well. So we'll have that discussion after the break. You're watching 22 News in Focus. Welcome back to 22 News in Focus. Today we're talking about the increase in people in need of mental health services due to the pandemic. The recent surge in COVID has some people losing hope that things will never get back to normal and their lives will forever be changed and not for the better. So Enrique, have you seen an increase in demand for adults needing service?
Yes, I have seen an increased need for services including behavioral health, mental health in general, psychiatric services, as well as substance use and recovery.
And so, like you said, there's been a rise in alcohol and drug use. The number of overdose deaths and suicides also climbing. So how can we be alert for signs of mental health troubles in a friend, a coworker, family member?
I think at this point, since we're going through a pandemic, we should assume that everybody's going through some kind of struggle in regards of their mental health. So it's very important that we keep addressing this with our family members, with our coworkers. Not everybody's gonna be willing to talk about their mental health. However, it is important to just acknowledge that we are there to support people if we can help in any way, and if they need our support, just be there. Sometimes, with life and all our activities, we get busy and we forget that we have to pay attention to ourselves. But it is particularly now very important that we dedicate at least a little bit of time to our mental health. Like you said, substance use is increasing, and this is happening for several reasons. And I'm just going to mention one of them, which is being at home and staying at home. People have access to either prescribed drugs or any other type of legal substances like alcohol, for example. So people are drinking more, people are using more of the prescribed medication, and this is becoming a problem for some people. So just be there for everybody and assume that we all need help right now in some way.
And so you said not everyone's going to want to talk about it, but how can we approach someone with our concerns, and not make them defensive?
So it can be challenging depending on the person, because for some people might be more difficult to express themselves. We should know who we are talking to or trying to approach in a way that doesn't sound like we're telling them what to do or what we know is best for them, but more like we understand that something might be going on, and if in any way we can make it easier for them with, within the family system, if we see somebody struggling and we know they don't talk about their feelings or what they're going through, we don't have to make them talk. We just have to make them feel like things can be better, or we can help them in some way, either by just spending time with them, help them do something that they like to do, but they might not be doing it by themselves. Sometimes they just need that little push to start engaging in things that might be healthy or helpful for them.
And we've been talking a lot about how to recognize mental health issues in others, but how do we address the possibility that we may be having trouble ourselves?
Yes, like I said, we have to assume that our mental health right now is much more sensitive because of everything that is going in the world, that for some of us, our routines changed a lot. Some people have stayed at home for months. Some people are going to work, but they're not interacting with everybody. We have our faces covered all the time. So this creates this distance that we are not used to. So we have to give ourselves some time, even if it's just a couple of minutes, to look at ourselves and just be honest with ourselves. How are we feeling? Every day, try to remind ourselves that even though it seems like we're going through a really hard time, we can always ask for help and support. Now, it is challenging because sometimes we don't have the time, or sometimes we just have other priorities. But I would ask everybody to give yourselves a little bit of time, a couple of minutes, and then try to do things that you enjoy, and try to not do everything or make everything about the problems that we're going through right now.
Right, do things that we enjoy. What are some resources for reducing stress and healthy coping, managing isolation and loneliness, that is?
So this can be complicated, especially now, because some people are still more isolated than ever. They either don't want to or cannot go outside and interact with other people as they would like to or as they're used to. But I would say there are different activities that people can do at home, including moderate exercise, physical activity, even just going for a walk, which is something I recommend to my clients. Just try to engage in an activity that you enjoy, that it's easy for you to do, that doesn't require a lot of effort, and that you feel like you would be able to add to your regular routine. For other people that are more social, if they cannot be physically close to other people, I advise them to use the technology that we have right now and try to talk to them, either a video call or a phone call. I have some people doing both, and by that I mean talking to someone through the phone while walking in the house. I know this sounds like maybe not the best solution, but it just makes them move and talk. So really we have to be creative.
Okay, be creative, sounds good. And I'll have some final words when we return. You're watching 22 News in Focus. Welcome back to the program. Today we've been talking about the impact of COVID-19 on mental health. And we want to thank Enrique Vargas Gonzalez for being on our program today. We also want to thank our viewers for watching, and if you missed any of it, you can watch it in full on our website at wwlp.com. From all of us here at 22 News, we wish you a wonderful day.